Dear friends, and in the following topic, the chapter we are going to have now is the second to the one we started on the erectile dysfunction. Introduction is already presented. Let's see what causes erectile dysfunction. Let's see the cause. Let's try to understand erectile dysfunction. What are the why does it start from the beginning? Where does it come from? What are the predisposing factors? Let's see it one by one. If a man is physically well, his penis is fully functional, and suddenly he loses erection. Then it takes a period, nothing is changing. 3 months, as we said, erectile dysfunction is already established. One, you need to see what are the underlying cause. We need to investigate. There are organic cause and there is psychological causes. These ones are organic. They are mainly vascular, 90%. The vessels, especially when there is arterial insufficiency or atherosclerosis. Atherosclerosis, they are fat, the fat that would go in the vessels and block the blood supply to the vessels of the penis. Please, if you want to understand the atherosclerosis and the negative impact of different diseases on the vessels, you can check the topics that we saw on the chapter 30, the chapter 1 and 2, because it's chapter 1, A, B, C, D, E, and second one, where we talk about hypertension and diabetes. It will help a lot to understand these issues of vessel insufficiency, atherosclerosis. Endocrine, or low testosterone. If you don't have enough for male hormone, then this problem might start again. Diabetes, we spoke about it, we saw it in the previous presentations. And abnormality, structural abnormality, the penis has abnormality in itself, physical abnormality. Neurological, neurons, we have some wires which works like electric wires that help us to feel. If you touch water, hot water, you will feel that this water is hot. If you touch cold, you feel that this is cold. It is because of the wires that are responsible to take information to the brain. Now, if those wires are damaged, which are all over the body, eventually on the penis as well, then it can be one of the causes as well. The medication that people take, most of times when you take medication without indication or just a side effect of medication, one would understand that it's not good to take medication without any prescription, without getting a written prescription for somebody who knows which one is good for you, than just treating. Self-treatment is not good. Though there are some side effects that we cannot avoid, because the doctor will give you medication after putting on a scale. Is the side effect that the medication is going to cause more harmful than the problem we have? Then we need to do that approach in consultation before you start medications. Psychogenic problems that affect the mind, the thinking. If you are permanently in stress, depression, this can be the cause, and it is quite high because 10% is a lot. Then if we go to a little bit detailing this, they are giving us the list with the mainly incidences seen in neurological, those wires we're talking about, and vascular. Then others, it will be medication, hormones, and psychological. We need to remember that impotence is not by itself a disease. It's not a disease, but it's a secondary to a primary cause. You will be having a problem that will start, then it will lead to erectile dysfunction. And it can be a side effect or a symptom to something else. as we spoke about like medication. So when you go to causes now, one by one, on the physical importance, we can see that diabetes mellitus is on the first line. Diabetes. Please go and visit the previous chapter to understand the diabetes. It's very clear. We try the best possible to make it so simple that everyone can understand. That's why I always ask people who have more information to come on board. And you who are following, ask questions. We answer them. We are a team that is willing to contribute in giving clarity to many things that we don't understand. Diseases of blood vessels, we spoke about hypertension, or just vascular diseases. And if there was a surgery on the pelvis that the pelvic that near the genital area, there was a surgery that affected what? The function of that organ or the nerves. If there was a trauma, the spinal cord was injured, where the vessels the wires are coming from, and the vessels as well. We will see. We are going to see it in the next slide. Hormones. The hormones, we spoke about testosterone and diabetes. We remember that diabetes have a very, very close link with the hormonal problem, including insulin, that is from pancreas. Prescription of drugs, substance use, and these drugs that people use without control, they are causing this problem as well. Multiple sclerosis, a disease that can affect the skin, but also it can affect the vessels as well. Other ways of just summarizing the causes or the predisposing factors by just creating mnemonic word, penis, it helps not to forget what are the causes, where it comes from. It will be psychogenic, endocrine, neurogenic, insufficiency of blood. Remember, we spoke about atherosclerosis, or substance abuse. So this is another way of not forgetting it. We need to remember that at least about 80% of this problem is organic. The vessels that we saw, organic. Just slightly 10% around there to be psychological. Problem that start in the mind, frustration, anxiety, stress, depression. But there are other 5% that are really not known, the cause. The cause is not clear. But the cause is there, but still to be investigated. Start studying, know where these things are coming from. So some major drugs that can cause this problem, the drugs, the endocrine, the hormones, the different hormones. There are people who like it to inject themselves hormones, for reasons that are not understandable. A person just decide to inject hormones, or by mistake, or by other reasons that we don't know. If a man takes estrogen, a man who has been functioning very well without any problem, if you use the estrogen, you might develop erectile dysfunction, because this is a female estrogen. Even though a man have a very little quantity of estrogen in the body, but if you give a lot, as if you are giving the hormone of a female, then you might get this problem. Anti-hypertensive drugs, especially when you get them without prescription, without, you don't take them anyhow. You need, for example, if you find that you are hypertensive on the first time that you are diagnosed with hypertension, it's not a mandate that you should take medication straight. There is a way to manage it before you start treatment. The treatment should be given for good reasons. And the doctor will always put on a scale and say, is it really indicated or not indicated? So there are also psychotropic medication, those which help on mental health care users. Some will have the impact also, which like a side effect on the erectile dysfunction. So still the same, these medications should be given on a prescription with somebody who is competent, who knows what to do. substances that people use, beer, wine, whiskey, cigarette, these products, they have a very negative impact on the blood vessels. It's a fact. You can find it. If you take it over and over a long period of time, then the damage is unavoidable. You know, illegal drugs, the one people use anyhow. The drugs that we know, the marijuana, heroin, cocaine, and as well as other drugs that are on the market, they will come and affect this organ, which was previously well, and you can see the vessels inside, and eventually the anatomy will be damaged. Then it will bring about erectile dysfunction. Cigarette smoking, it's known to be the cause of impotency. Erectile dysfunction. Why? It does decrease the blood flow in the vessels. Not only that, it destroys the vessels. It's a poison. It's a poison that will destroy the vessels. Now, the damage would depend on how long we have been taking and how much you are taking of the cigarette. Cigarette smoking, like here they tell us that in a study that was done in 1991, for a man who took 20 cigarettes per day for 5 years would have 15 chances of developing this problem compared to non-smoker. You see, now somebody is a smoker, another one is not a smoker. They can't be the same on health-wise, on vessels. Now, if the same study keep on telling us that the same people, the same group of people who did take a cigarette for 20 years, taking 20 cigarettes every day, they would have chance, which is, or developing the artery getting blocked, the vessels getting damaged. The chances compared to non-smoker is times 72. So it's very high indeed. So one can understand the cigarette and negative impact of it. It will bring disasters in the home. Psychological problems, a man depressed is no longer able to perform. It will affect the wife as well. So this is psychological cause that we need to know: the stress, the anxiety, depression. Especially you can see if it can be either to job loss or the marriage has problem itself. People are not understanding each other. Financial worries, the financial burdens, the depression can rise then until it cause this erectile dysfunction. We are talking about causes and the predisposing factors. Neurological causes, we saw that there are wires that all over the body which help to take information from the eye. Information will come to the spine, going to the brain. Information might come from the stomach, going to the brain. Same here in the pelvis. Come from the testes, come the blood from the bladder, come the, if it's a female, from uterus. Still the same information has to come to the spine and go to the brain for interpretation. So if the spine is injured, one would understand what would happen. If there was a surgery on the pelvis, around the pelvic genital organs, and that surgery might be the predisposing factor for erectile dysfunction as well. If you had an accident and the spine was injured, spinal cord is injured, where those wires which takes electricity information to the brain, then that damage would also interfere with erection. You can see here they are showing us clearly how the wires will come from the spine going to the brain. They come now specifically on the pelvis. The wires here in blue, they come from the spine. They come to give information to the genital organs and pelvis. Now, if now you have an accident, we have a fracture here. Now, information of this wire will not be able to go. It's electricity. Electricity, if the wire is cut, you want to have light. Same principle here. Now here they are showing us a very clear network, a network of many plexus of the electricity, the wiring, the wiring that helps on the electricity. Some are going to the bladder, others are coming to the prostate, the important gland that secretes the fluid, which will dilute the semen from the testis. The time of ejaculation, the fluid will come in for ejaculation. So this is done because these wires are functioning very well. You see, there is another one coming to the penis to give a command. So these are the neurological factors we need to address. The picture showing a very clear network, not only blood vessels coming to the testis and penis, but also there are these wires which will take information, electricity, going to take information to the brain. Medication. Drugs can cause side effects, as we spoke before, and it is reported that at least 250 drugs, different drugs, are incriminated in being responsible for erectile dysfunction. So we should not run to medication always. Medication, everything medication. Not everything needs to be treated with tablets or injection. Consultation, then we start with lifestyle modification, then medication. So these are the predisposing factors. Hormones. If the hormones are not well balanced or you are not producing any, then the problem will be, we know that testosterone is secreted in the testis of a man. Testosterone, if now, say like there was a castration, or there was an accident, or there was a disease that destroyed the testis, then it simply means testosterone will not be secreted. Then we won't be having the hormone, which will result in erectile dysfunction. You can see the testis is very clear, showing the clear anatomy with the canal that will take the sperm out, which will come eventually meet the prostate. Once it is diluted with prostate, with the vesical seminals, which will add more fluid during ejaculation. Now, if the hormones are not functioning well, that would be a problem. Here they are showing us the vascular system to show the vessel, the big vessel from the heart, this abdominal aorta, which will divide into left and right, and eventually will give branches, the branches that will come to the penis as well. If these vessels are damaged, whether the big ones or the smaller ones, all can result in erectile dysfunction. So these organs need to be in good health so that the system can work very well. So another problem is the venous leakage, where if the blood that are supposed to fill in the penis are leaking back, if they are no longer able to close fully and maintain erection, then that will be a serious problem. You know, that venous leakage is a problem. A man may be able to achieve erection, okay, or partial erection, or cannot maintain erection just because blood is escaping back. The blood that's supposed to fill in and maintain the penis hard enough to penetrate. If the blood escapes back, then penetration will not be possible. So these are the vessels they are showing us, which are very important with that organ that helps on the erection and the maintain. They're showing the inside, and this is a penis with many vessels, which should remain hard during sexual contact. So diseases that affect blood are mostly the serious, constituting the serious problem. Atherosclerosis, we spoke about it, or simply the vessels which are getting hard, they are no longer able, reducible. There is no flexibility where the blood can come and fill. So it will just interfere with the diameter of of the vessel where the blood should fill. We know what we call heart attack. Heart attack, we spoke about it in the previous presentation, or the clots blocking the vessels on the heart. Same problem can happen also on the vessels of the penis. this kind of atherosclerosis and complications can affect the penis. So when it is not the brain, it brought the stroke, and when it is not the penis, it will produce impotence. So we speak about stroke on the brain. We can also use it on the heart, stroke on the heart, but also on the penis to result in impotence. Thank you for following the presentation. It was a bit longer, but it was important, I believe. Your questions are welcome. We will continue this topic, seeing the sign now, symptoms. How do you know that one has impotence, how he has erectile dysfunction? Let's see it in the following presentation.